When they tell you about postpartum depression, you think about, okay, I feel negative feelings towards my child. I want to injure my child. I want to hurt my child. I've never, ever had those feelings. And some women do, but you don't realize what broad of a spectrum you can really experience that on.
That was Nashville actress Hayden Panettiere. She appeared on Live with Kelly and Michael talking about her experience with postpartum depression. And now People magazine reports that she has voluntarily checked herself into a treatment center to get some professional help as she battles postpartum depression. To discuss, joining us now, psychiatrist Dr. Dion Metzger, who has treated patients with PPD, and mother of two girls, and also senior writer here at Weekend Express, Heather Murphy, to give us the mom side of this experience. Good morning to both of you. And Dr. Metzger, I want to start with you because we hear about this spectrum, and a lot of women struggle with, where do I fall in it? How severe am I? Let's start with baby blues and the symptoms of them.
Sure, and baby blues is something you notice as soon as the baby is born. Just feelings of sadness, low energy, problems sleeping, even changes in appetite can happen. But a lot of crying also, but just feelings of guilt about not being a good enough parent. Those are usually the classic symptoms.
Then you shift into something a little bit more serious, postpartum, where it becomes those thoughts of possibly harming your child. What else?
Right, and just neglecting to take care of yourself, just not even having the energy to do anything, to take care of the baby, to feed the baby. And sometimes it can be so severe that people have suicidal thoughts or have thoughts of wanting to harm the baby, like you mentioned.
And maybe separating yourself from your family and friends, which is so unusual.
Complete
and then
isolation.
You take it to a third step, postpartum psychosis.
Yes. And this is very scary. I've actually treated this in the hospital before, where they start having psychotic symptoms, which can include hearing voices, having visual hallucinations, paranoia. But this can really put the baby in danger, because they may have paranoia about the baby, that they have to do something or harm the child, and that can be really scary.
What about women that aren't sure where they fall in that? Maybe I'm baby blues, maybe I'm postpartum. When do you go see a doctor?
If you have any suspicion, I always say just go. Because even if it's just baby blues, it doesn't hurt to get an evaluation and see what's going on.
You know, it sort of strikes me, Heather, that we have to wait until a celebrity talks about this to have a discussion about it. I've spoken to other women that say women don't talk about it. Why do you think that is?
I think there is a strong feeling that you, especially for me, my postpartum depression hit after my second child. And the first child, the pregnancy, the postpartum period was so easy, and it just went so smoothly, and I had great support. And I had friends who I had first children about the same time, and we all had our second children about the same time. And everybody else seemed to be doing so well. And I seemed to be struggling, and I just wondered if I was not matching, I wasn't living up to the expectations. I was doing something wrong, because everyone else seemed to be having a good, easy time of it. The truth was, nobody was saying they were having a bad time.
And maybe the failure of possibly not being the parent you would expect yourself to be is the hardest thing. Was it the help of spouse, family that got you to a place that you felt better?
No, I had to seek professional help. Ironically, I went to my doctor and in my 6-week postpartum checkup, and I said, I don't feel right, something is not wrong. And I was crying through the whole examination. And she patted me on the leg and she said, it'll get better. So I thought it was supposed to. It was a year before I was diagnosed and before I got help.
And that goes to Dr. Metzger's point of get help, that it won't just be that your spouse is supportive or that your family is helping you out. You need the professional help. And maybe for moms to be that may think, how do I not get this? This stigma of is there a preparation?
No, there isn't. And what they're finding now in the new studies is that the depression actually starts during pregnancy. And 50% of women, they're starting during the pregnancy and then sometimes may worsen postpartum. But always just pay attention to the signs.
Pay attention to signs. Ask for help when you need it. Get help when you need it. And most importantly, have a conversation about it. So thank you for sharing your story, and thank you for the advice, Dr. Metzger and Heather Murphy. Thanks for being with us. And our in-depth conversation continues. In the next hour, we're going to talk more about how early some moms may start feeling depression. As Dr. Metzger said, talk to your doctor if you think you may have peripartum or postpartum depression. Also, for more information, you can go to cdc.gov/reproductive-health/depression, or you can talk to a trained counselor at the National Suicide Prevention Lifeline. That phone number is 1-800-273-8255.